Dr. Atul Mohan Kochar, CEO, National Accreditation Board for Hospitals and Healthcare Providers with us. His special address will be on relevance of quality in the post-pandemic era. NABH Accreditation, the way forward. Over to you, Dr. Atul Mohan Kochar.
Thank you, Mr. Shobit. Thank you all. Thank you, APAC, for this invitation. Thank you, Mr. Pathak sir, Dr. Madan Gopal, Mr. Bhushan, and all the dignitaries of the dais. Let me take this opportunity to introduce NABH. NABH, you may all be very familiar, but we started out in 2005 with one standard and one program. But today, after 15 years, we have 21 standards and 21 programs, and we are constantly developing more. We are trying to develop standards for dialysis, strokes, home care, senior care, and a variety of other niche areas, including digital health. So coming to the strategies for digital health, let me place on record that when COVID broke out, we were caught in a limbo. Our assessment methodology is a very traditional methodology. Our assessors visit hospitals, they write reports on papers, they submit the reports, the committees go through them and then award a decision. But once the COVID broke out, the entire travel industry came to a standstill. There was a real danger. The interactions became very, very difficult. So we had to very fast switch over to a digital methodology. So we developed in a very short span of time policies for everything. So more than 250 policies were developed so that we could carry out our vision with same thoroughness, same objectivity, transparency, and objectively in a digital mode. So we had to shift that. We were very successful. Until date, we have carried out more than 3,000 virtual assessments on various platforms in a secure manner where we ensure data protection, totally HIPAA compliant, everything. And so that is the way forward. And everything has been said about Health 4.0, the new resilient digital ecosystem which is all around us. And that's the reality, friends. So what we are looking for now is that the COVID has given us a huge opportunity. This disruption has led us to some very real low-hanging fruits. For example, as Mr. Bhushan very rightly pointed out, that their hospital suite was already there. It was in 5 different applications without, in silos, not talking to each other. Now they have bundled them together and make them more relevant so that they are all integrated, seamless, and more meaningful. Mr. Pathak very rightly pointed out that time is now, that now we have to really make a difference, and there are no constraints, and India has risen to the challenge. And I'm sure Dr. Madan Gopal, who is in the very actively thick of the things as far as Niti is concerned, and he himself is a very keen part of everything from vaccine development to healthcare strategy to dissemination. So now is the time to break out of all our old traditional barriers and think of something new and lead us to a massive change and use technology to do that. So this entire digital health, today NABH is touching about 12,000 hospitals under the 3 broad headings of accreditation, certification, and empanelment. And we also realize that there are maybe 1 lakh of hospitals which are not with us currently. Maybe 3 lakhs of small clinics or 10 lakhs of small clinics, very, very small clinics in tier 4, tier 5, tier 6 cities. So we are very proud to have with us, partner with us, all big chains, the Apollos, the Medantas, the Fortis, and the Max. But we realize that we have miles to go where there is no absolute constant of a quality. There's no idea of what ideal quality or a patient safety should be. So this is the core area where we aspire to be, and the only thing which platform, the bridge which can lead us to that is the technology, the digital. And digital health is still evolving. The ABDM has been a game changer. The Ayushman Bharat Digital Mission is going to provide a framework. They have already now 2,000 applications logged on into the system, which is going to give an opportunity for millions of coders, for software developers to provide harmonized apps and applications and softwares, which is going to provide just that kind of bridge, where we can use technology to bring all those masses and all those smaller setups onto the quality network. We realize that NABH may provide a key role for that, and we are very willing to invest our time, energy, and everything into giving that solution or bringing on board, because in principle and in every way, we are very actively collaborating with NHA, with ABDM to create a more meaningful ecosystem. So talking about digital health, we have already started working on that. We have already started to draft a standard which will weave together all the technology standards. And India has already shown the world by the CoWIN app, by the Aadhaar, that we are in a unique position. There's already lots of confidence in the world that India can deliver it, where the world couldn't. And COVID has also brought us on a very similar platform, so that there is no right or wrong. I mean, in the countries where we aspire to the infra which is there, for example, having worked in US as a clinician, I know that they have a really 7-star kind of an infrastructure. But that has also not performed as well, because the death rate in those countries is much beyond what we have seen in our country. So that is something to look forward to, that a positive change which is brewing. And we must not, I am sure that these meets and thought idea generating meets like this third APAC meet, I wish you all the best, Mr. Shobit, and the entire team of APAC for bringing together leaders. I see Dr. D.K. Gupta, and there are so many leaders in the audience, and all of them must, this think tank must contribute and take this digital resilience to the next level. And we must not rest by hand-holding, by sharing our ideas, by sharing our thoughts, till we take quality to the last man in the line. So that is the key area, till we take the basics of patient safety, surgical site safety, communication safety, everything, to the tier 4, tier 5, tier 6 cities. Only then, because as Mr. Pathak very rightly pointed out, we cannot be secure in our islands of excellence. We cannot say that we have received 2 doses of booster while our friends in South Africa maybe have not received 1. Otherwise, it will all rebound and come back to all of us. So similarly, with the digital thing also, every software or training or hand-holding, we have to disseminate to the furthest thing, and NABH is willing to invest and play its part in taking these basics of education in digital health to the far-flung nooks and corners of the country. So thank you so much once again for this opportunity, and I wish you all the best. Thank you.
Thank you so much, Dr. Atul Mohan Kochar, CEO, NABH, and